Across Ontario, public health units are blaming the Delta variant for a rise in COVID-19 cases. And new modeling numbers show that increase will continue higher. But it's not all bad news. As Sean Cowan reports, Ontario's top doctor is offering up some hopeful predictions as well.
We could see close to 3,000 new cases daily by the end of January if vaccinations for children don't increase. But if kids between the ages of 5 to 11 keep getting shots, we'd be looking at just over 1,000 new cases daily. That's all according to new modeling released today by the province's Science Advisory Table.
While there are many unknowns, what we do know is that the basic public health measures are effective against COVID-19 and the Delta variant, and will also be effective against Omicron.
Even without Omicron, ICU occupancy will likely grow between 250 and 400 in January. But Health Canada is currently reviewing new antiviral medications to help fight the severity of COVID-19. And Moore says his team just found out today that medication could be here in the new year.
But they could play an important role together with monoclonal antibodies to reduce the impact on our hospital sector.
Now that we're coming up to the 2-year mark with COVID, CHCH News asked the doctor if the virus is here to stay. And will we need yearly boosters? Dr. Moore said many companies are already looking at combo shots, one vaccine to protect you both against the flu and COVID.
But I do see a time when we'll have low endemic rates, and it will turn out to be like influenza or other winter respiratory viruses where there's a seasonality to it, where it does have an intermittent impact on our healthcare system. And like influenza, you need an annual vaccine to protect against it.
And Dr. Moore also talked about January 17th. That's the date the Ford government suggested that proof of vaccination may no longer be required for places like restaurants, bars, and sports facilities in Ontario. But the doctor said it's too early to make any decisions yet, but will make further recommendations in the new year based on COVID-19 rates.